What happens when you quit caffeine with PTSD? Have you ever wondered how quitting caffeine might affect someone with post-traumatic stress disorder? Caffeine is a stimulant that can activate the central nervous system, triggering the body's fight or flight response. For those with PTSD, who often deal with heightened anxiety, caffeine can make symptoms worse. This includes feelings of nervousness, heart palpitations, and even panic attacks. So, what happens when someone with PTSD decides to quit caffeine? When a person with PTSD stops consuming caffeine, especially if they do it suddenly, they may face withdrawal symptoms. These can include headaches, irritability, fatigue, difficulty concentrating, and even flu-like symptoms. The body has become used to caffeine's effects, like increased adrenaline and dopamine levels, so it needs time to adjust when caffeine is removed. For instance, headaches can occur because blood vessels in the brain widen after caffeine is stopped, reversing the constrictive effects of caffeine. Initially, quitting caffeine can feel unsettling for someone with PTSD. Without caffeine's stimulating effects, they might find their anxiety or panic symptoms more intense. This heightened awareness can make PTSD symptoms like hypervigilance or dissociation feel more pronounced. Some individuals may have relied on caffeine to cope with fatigue or emotional numbness, so its absence can feel like losing a support system. On the flip side, reducing or eliminating caffeine can lead to significant benefits, especially regarding sleep quality. Caffeine can disrupt sleep, even if consumed several hours before bedtime. Since poor sleep is a common issue for those with PTSD, better sleep can enhance overall mental health. Improved sleep can reduce daytime anxiety and help individuals process trauma more effectively. Additionally, chronic caffeine use can exhaust the adrenal glands, which play a role in regulating stress hormones. This can worsen the stress response in PTSD. Over time, relying on caffeine may hinder trauma recovery by keeping the nervous system in a heightened state of arousal. In conclusion, quitting caffeine while managing PTSD involves navigating withdrawal symptoms that might temporarily increase discomfort and anxiety. However, it also opens the door to better sleep, reduced stress, and potentially more effective healing from trauma. Gradually tapering off caffeine rather than stopping abruptly can help minimize withdrawal effects. It is crucial for individuals with PTSD to consult healthcare professionals when adjusting caffeine intake, as this can significantly impact their mental health and coping strategies.